What's up, y'all? It's Dr. Mia, your B3 specialist and board certified gynecologist at Me Bella Wellness Center, where we offer gynecology to women and adolescents, as well as hormone pellet therapy, weight management, intimacy services, laser hair removal, and total wellness with supplements to men and women of all ages. Our goal is to help you live well, age well, and experience everlasting intimacy. And again, we are founded as a gynecology practice. So today we're going to talk a little bit about some gynecology subjects. And we're going to talk about PCOS and insulin resistance. And we want to talk about PCOS and insulin resistance because it's affecting so many women and so many young girls and adolescents and teenagers. And it stems from having a family history of diabetes. Hey, Dr. Sam. Also, it stems from, symptoms associated with PCOS is skipping cycles, facial hair. So at a young age, having a beard, having chin hairs, having thick hair around the nipples, thick hair on the abdomen. One of the biggest signs and what usually brings women in to see me is that they are also having irregular cycles. They may have normal cycles for a few months and then skip 2, 3, 4, 5, 6 months of cycles. And so then when they have a cycle, it's really heavy and it can really negatively affect their quality of life. But the real issue is the insulin resistance. And when I say insulin resistance, that means that with someone with insulin resistance, they tend to have a family history of diabetes, like in a parent. And when I say family history of diabetes, it may even be pre-diabetes, or it may be that they, if they're older, that they had gestational diabetes, or their mom had gestational diabetes, or their mom or dad have full-blown diabetes, or they just have pre-diabetes, meaning they are predisposed to it, but they have controlled their lifestyle enough so that they haven't graduated to having full-blown diabetes, okay? So that means that when you eat sugars and carbs, if you're insulin resistant, then your body puts out way more insulin than the average person. And that extra insulin floating around knocks your hormone levels off, which makes you not ovulate, which makes you start skipping cycles. But it also increases the androgenic hormones, which are the male hormones, because of this insulin and high insulin levels. And with the increase in the androgens, that's when women will start to notice the facial hair, the acne, the hair around their nipples, the hair on their abdomen, the weight gain specifically in the abdomen. And they notice that it's really, really difficult to lose weight. And it's really difficult to lose weight when you're insulin resistant and when you're a diabetic. It doesn't mean that you can't lose weight. We're going to talk about that in a few, but it is difficult to lose weight. So the important thing is that this can affect fertility, because if you're not ovulating, you can't get pregnant. So, but there are things that we can do as providers to help you with ovulation. One is to start losing weight. That's like the biggest thing, is lifestyle change with this disease process. Again, the disease process is PCOS, or polycystic ovarian syndrome, which is where you're skipping cycles, have increased facial hair, acne, weight gain, difficulty losing weight, and irregular cycles, which could cause infertility. Because again, if your insulin levels are staying high because you're eating rice, bread, pasta, potatoes, sugary beverages, juices, sodas, all of those things are going to increase your insulin levels, because your body just does not regulate insulin as well as somebody who's not insulin resistant, and your body puts out way too much. The high insulin levels make it really difficult to lose weight, to burn fat, and to have regular cycles. And again, one of the main reasons people will come to see us is because of the irregular cycles, or they've been having irregular cycles and now they have this ongoing cycle where they can't stop bleeding, and they're bleeding every day, and it's really heavy, and it's negatively affecting their quality of life. A lot of women don't come to us because they're actually skipping cycles, especially if they're not worried about being pregnant. They're excited that they're not having a cycle, and that's not a good thing. It's okay to not have a cycle if you're on hormonal birth control and you're premenopausal, but it's not okay to not have a cycle if you're not on any medication that's stopping your cycle. If you're just not having cycles, you need to see your gynecologist immediately so that you can get a thorough workup and make sure we're not missing important things, because other diseases that go along with insulin resistance would be heart disease, high cholesterol, high triglycerides. So you want to make sure that you get the screening for all of that. and you change your lifestyle so that you don't get full-blown diabetes or heart disease and some of the other diseases that go with metabolic syndrome. And this is a metabolic disease. Whenever you're talking about pre-diabetes, diabetes, or insulin resistance with PCOS, those are metabolic diseases, and they can lead to metabolic syndrome, which is where you go past just diabetes, but now you have heart disease, you have high cholesterol, and you have a lot of other chronic diseases that can definitely increase your risk of early death. And the number one cause of death is heart disease. So uncontrolled diabetes, high insulin levels, high cholesterol levels, high blood pressure, all of those things can increase your risk of heart disease as well. So this is a very serious topic. It's affecting a lot of our younger women. You may have daughters that started out having regular cycles. They play sports. They get to college. They stop having regular cycles. They start noticing all of these other symptoms. They need to be seen by their gynecologist for a good workup so that we can determine and make sure that their hemoglobin A1C is not in a diabetic range. So hemoglobin A1C is a number that looks at what the average blood sugars have been of someone over the last 3 months. So it's a good tool that we use to make sure that you are not prone to insulin resistance. You don't have insulin resistance. When that number is 5.6 or less, we consider it normal. But still, if it's an 18-year-old that's skipping cycles and her hemoglobin A1C is 5.6, I know she has insulin resistance, and I should treat her as such to decrease her chance of getting full-blown diabetes or type 2 diabetes, which could require insulin and negatively impact their health and their quality of life. So again, regular monthly cycles are normal. If you're skipping cycles, especially 1 to 2, 2 to 3 cycles at a time, that is abnormal, and you should see your gynecologist about that. This process can be fixed with weight management, as well as weight loss. And it can also be fixed with lifestyle change and diet change. And when I say lifestyle change and diet change, that means decreasing your sugars, eating kind of like a diabetic should eat, which is decreasing sugars and carbs, limiting them, not meaning that you have to completely not ever have any sugars or carbs, but you definitely want to decrease the amount, and you want to decrease the kinds of carbs. So instead of doing white bread, white pasta, white potatoes, and what's the other one? Bread, pasta, rice. Instead of doing white rice, do brown rice. That will definitely help because those foods have a lower glycemic index than the white stuff. However, you still want to make sure you're focusing on getting healthy protein in. You can do the healthy nuts, the lean meat, as well as the increasing your vegetables. And you still don't want to do too much fruit because a lot of the fruit has a lot of sugar in it. So yes, mindful eating, making sure you're not eating all of the white foods, but you're eating the brown, more complex sugars, which are going to be better for somebody who already has insulin resistance because it's not going to negatively affect insulin levels. So it's kind of like why intermittent fasting works. Everybody does intermittent fasting because what you do with intermittent fasting is, since you're not eating for such a long period of time, you're keeping your insulin levels low, and it's easier to lose weight and burn fat when your insulin levels are low. If your insulin levels are high, it's really difficult to lose weight and burn fat. So, that brings on the conversation of weight management. At Mibella, we do offer weight management. We only have 3 programs at this time. We have an 8-week program for those who need to lose 30 pounds or less. We have a 6-month program for those who need to lose more than 30 pounds and who know that they need the long-term help for lifestyle change. And then we have a modified program for those patients who are at their goal weight with the BMI of less than 27, but they either have noticed that they're starting to gain weight back, or they want to lose 5 to 10 pounds so that they can optimize their weight and their health. Our programs are focused strictly on behavior modification. You meet with the provider every 2 weeks. We do behavior modules. You come in, you fasting, you do that rest and metabolic rate test. We know exactly how many calories you need to eat, and you get on that body composition analysis scale on a regular basis. But the biggest deal, and what I've learned over the last 13 years of doing weight management, is that the behavior modification is going to be key for true lifestyle change, because at the end of the day, the way to lose the weight and keep it off is to develop a lifestyle that works for you specifically and individually, because we all have different lifestyles, but to change your lifestyle, we need to figure out what's going to work for you and the way that you work and the way that you socialize, and the way that you burn fat. And we know all of that information once you come into the office and do your body composition analysis. We know what your baseline muscle mass is. We make sure that you don't lose muscle when you're losing weight, and we make sure that you're losing fat. With the risk of metabolic rate test, you come in fasting, you breathe in our little machine. It usually takes anywhere from 5 to 12 minutes. With you breathing in the machine, your nose is clipped so that the CO2 cannot escape out of your nose, but it goes through the machine, and that machine measures your CO2. And based on that, it will quantify what your true resting metabolic rate is. The way to improve metabolic rate is, one, to have breakfast in the first hour of waking up and not doing the intermittent fasting thing. So eating breakfast within the first hour, eating frequent small meals every 2 to 3 hours, and making sure you're getting plenty of protein as well as resistance training to hold on to the muscle that you have. Those are going to be the things that help increase your metabolism. And also, if you're over 35 or 40 and your testosterone levels are low, then testosterone replacement actually helps you hold on to muscle, which holding on to muscle increases your metabolism and makes it much easier to lose the weight and keep it off. So again, thank y'all for joining. This is Weekly Wellness with Dr. Mia. We're talking about insulin resistance and PCOS. A lot of us have insulin resistance anyway, but we may not have the symptoms of PCOS like skipping cycles. But if you have insulin resistance, it does make it harder to lose the weight and keep it off. And so what we focus on is figuring out what's going to help you individually based on your medical history, based on your history of exercise, based on your present exercise and movement, and then based on your metabolism, your muscle mass, your age, your hormonal balance, and we determine a plan that's going to work for you. And again, what's pretty similar to everyone's plan is breakfast in the first hour, eating every 2 to 3 hours, doing the behavior modification, and then journaling your food and actually journaling how you feel so that you can more mindfully eat and know what works for your body. I know the foods that make me feel good. I know the foods that make me feel bad. So if I focus on the foods that make me feel good, that don't give me gas, that allow my bowels to, work like normal, that keep me full and satisfied, then it's going to be easier for me to lose the weight and keep the weight off. And, we all kind of go up and down. Weight management can definitely be emotional. So if you're not managing your stress and you're not doing anything to cope with stress, like have your therapist that you see on a regular basis, as well as doing some stress coping kind of exercises like meditation, exercise, therapy, making sure you have that accountability partner, making sure you have that friend that you can kind of talk things out with, but most importantly, having that therapist so that you are taking care of your mental health and wellness, just like we're doing all the things to take care of our physical health and wellness. So again, PCOS has started to affect a lot more women than it had in the past. And a lot of that has to do with our diet habits in the United States of America. They aren't necessarily good. A lot of us are gaining weight, and a lot of our children are obese and overweight now. And as a result, that has increased the risk of disease at early age, which includes type 2 diabetes, which includes high blood pressure, which includes obesity, which includes chronic pain, and all of those diseases that go along with weight management. They are increased now, and they're increased at an earlier age. And unfortunately, our generation of children will be the first generation of children that may not outlive their parents as far as life expectancy. And that's because they are getting these diseases like diabetes and high blood pressure and high cholesterol and heart disease at a much earlier age, which is affecting their overall health at a much earlier age, which is decreasing life expectancy. So all of us have to get on board and make sure that we're doing the things that we need to do to live a life of total wellness, including making sure we're doing the weight management component and we're living a healthy lifestyle to lose the weight and then keep the weight off. So again, I'm Bella. We are a gynecology practice, so if you're starting to notice that your daughters are gaining a lot of weight, or they're starting to get hair on their face, or they're starting to skip cycles, or they're having really heavy, long cycles, those are reasons for you to bring your adolescent girls into Me Bella. Another reason to bring them in is just because they're between the ages of 13 and 15, and they need to start having those real conversations about their own health, their own wellness, how to live a healthy lifestyle, and then have those conversations about prevention, about safety, keeping themselves in safe situations. And then also they may need birth control to control their cycles because they're having severe cramps, heavy cycles, irregular cycles. Those are all reasons to bring your daughter to see us at Me Bella, so we can start having conversations, working them up, and then addressing these healthcare concerns early so that we can teach them how to live a healthy lifestyle, so that these are not issues of concern as they continue to mature, especially as they get closer to that time of fertility when they're ready to have babies. We want to make sure that everybody can get pregnant when they want to. And one thing that could easily stop that is PCOS and insulin resistance and diabetes. So when my patients actually have pre-diabetes, I go ahead and start treating them as if they're diabetic to prevent them from getting diabetes, to help them lose the weight so that the insulin resistance improves, which helps with their hormones and helps to regulate their cycles and helps with their quality of life, and it helps them to feel better. The food in America has changed. We have foods in America that they don't have in other countries, that are banned in other countries. So our foods are processed differently and is not healthy. So as a result, we're seeing our children who are more overweight at younger ages and more obese. So the things that we can do is, one, start taking them to the doctor and having these conversations, and then trying to help them live a healthy lifestyle by us setting the example and teaching them how to live a healthy lifestyle. My daughter is going to be healthy because she eats what we eat, and she has the lifestyle that we create for her as far as health and total wellness. So we can all help control the health of our children by setting the example and living a healthy lifestyle, maintaining a healthy weight, and choosing healthier foods to eat, so that we don't have a lot of the health problems that we're seeing at younger ages, like hypertension, prediabetes, diabetes, insulin resistance, and all of the things. So if you have any questions, you can definitely put them in the comments. I'll be happy to answer your questions. If you have, if you know somebody that you love and you care about, and they're starting to have some of these symptoms and they're starting to gain the weight, especially our younger girls, make sure that you go ahead and schedule them an appointment at Me Bella Wellness Center, because our goal is to help our young children to grow up and be healthy adults. And then we want to increase the number of adults who live a life of total wellness, so that we can decrease these disease processes in our community. So if you have any questions, put them in the chat. Otherwise, I will see y'all tomorrow with Ageless Intimacy. And I think we'll be talking about intimacy and communication on tomorrow, which will be a great topic. So I hope to see you at 8:30 p.m. Central Standard Time. Me and Joseph will be on Ageless Intimacy with Dr. Mia and Joseph at 8:30 p.m. Central Standard Time in the same place. And I hope to see you there. And I hope you go live well, age well. And if you're old enough, experience everlasting intimacy. It's Dr. Mia. Y'all have a great Saturday. Bye.